Hi, Jim.
Hi.
What brings you in today?
Been having these episodes at night that couldn't explain. I felt like I was dying, having a heart attack.
Oh, really?
Yeah, so I went to my doctor and he ran tests and said my heart was fine, so
Good.
he referred me here.
Well, let's try to figure out what's going on.
Okay.
Before we get started, just want to let you know that anything we talk about is between you and I, except in a case where there's a court order or you had divulged to me that you want to hurt yourself or someone else or someone that's unable to defend themselves.
Okay.
We okay with that?
Yeah.
Okay,
absolutely.
perfect. Very good. Have you been treated for this before?
No.
Just looked at by your physician?
Yeah, just my physician. Yes.
Okay. And he said what?
There's nothing wrong with me. My heart's good. So I'm not having a heart attack like I
So
feel.
physically you're okay? Okay. Well, it's
Yes.
got to be some relief to you.
It is actually.
Yeah. But you still need to know what's going on, right?
Right.
So it feels like you're having symptoms of a heart attack.
Yeah, it's
Tell me a little about it.
well, it starts off I get like the chills. I feel like
Okay.
it's cold and like it happens in 85-degree weather, so it's not cold at all.
Mm-hmm.
And then it turns into slight tremors that turn into full body convulsions. Or
Full convulsions.
yeah, so my arms and limbs will be shaking uncontrollably. For
Kind of like you have a flu bug, but you don't.
no, kind of like I'm having a seizure.
Oh.
You know, which is one of the things that scared me. Because not only, but along with that, I also feel like I'm having chest pain, shortness of breath.
Okay.
I definitely feel like I'm dying.
I'm just going to take a few notes if you don't mind.
Sure, no, I don't mind.
Okay,
So I have a lot of this going on,
Mhm.
and so I thought I was having a heart attack, or maybe I was getting MS or something because of the shaking.
good. Okay.
And so that's why I went to the doctor. He said, I'm fine. Health.
How long has that been going on?
A little over 2 months. I'm in my third month right now.
Okay. And how many times a month?
It changes. I mean, I can have a string of them, one every day for several days, and then I can go 2 weeks without even having one. So it always comes up unexpected.
Is there any situation where it comes up more than others, or
No.
so it doesn't matter if you're relaxed or out in public? It can just come on when it comes on.
Right. Well, generally I'm relaxed when it happens.
Oh, really?
I'm not out in public, but it's been my fear that it would happen in public.
Oh yeah, I can see why.
Yeah.
It hasn't happened in public yet, though.
No, and the thing is, I mean, it's one of the reasons why I want help is because I'm constantly worried about having another one.
Now, do you feel this coming on, or is it just kind of a sudden?
It's a sudden thing. I have, it's complete
So
out of
once
the
you
blue.
feel the chills, the shakes are right behind it, and then.
Yes, and next thing you know, I'm just shaking, and that's, sometimes I don't even always feel the chills, but sometimes I just start shaking.
So you'll feel your heart pounding. What other symptoms do you
Yeah,
feel?
my heart starts racing, shortness of breath, tightness in the chest. Sometimes I get a little lightheaded, you know.
Okay. Sweat at all?
Not normally.
Not normally?
Not normally.
Is there any intense fear with it? I mean, do you feel as though you're...
I feel like I'm
You
dying.
feel as though you're dying.
Right
So
then and there, I feel like I am dying.
does
It's
that thought
terrifying.
consume your day when you're not having an attack?
Not the feelings of dying, but the fear of having it again consumes my day, every day.
Okay, but when you have the attack, you feel like you may be dying.
I feel like I'm dying at that moment, yes. And yeah. It's
So you have realized, after we went to your doctor, did you realize you weren't dying, or did you kind of figure that out before you went?
Well, I mean, no, I didn't know that until I talked to my doctor.
Okay, so that was quite a relief.
It was quite
I can
a relief.
imagine, yeah.
I gotta tell you.
Well, can I ask you a few questions? Just so I can get my head wrapped around what's going on here, and we'll see what
Sure.
we can do for you. Do you have any history of drug use at all?
No.
No. Okay. History of suicide in your family at all?
No.
Okay. Personal history of mental illnesses, or
Me, no.
okay. Anyone in your family have mental illness?
My dad had depression
Dad had depression. Okay.
and antisocial.
Was that diagnosed?
Yeah.
Okay. Okay. Any traumas?
No,
When you're a child or a little older?
no, I actually had a pretty decent life.
Okay, good. So we have no suicidal ideations on your side?
No.
No.
No,
Don't want to hurt yourself or
no,
anybody
I have
else.
no desire to do that.
No, well, that's good.
Or hurt others.
How about legal issues? Are you experiencing any legal issues or
No,
prior arrests, convictions, anything?
no, I've never been in trouble with the law.
Okay, good. I just wanted to go through some of those things because it gives me an idea about your past a little bit. And we're going to go a little deeper into that if you don't mind as we move on.
Sure.
Okay, good. So you were born in Alabama?
Yeah, wasn't raised there, but I was just born there, and then when as a baby, they moved out.
Oh, so you don't even recall much? Okay.
No.
So you're a Michigan fan.
I am.
Good, I can tell by your hat.
Yeah.
I like that. So your primary care physician referred to you, who is that by chance?
Dr. Smith.
Okay, and it says you reside in a house.
You're right.
And you are single.
Yes.
Okay, do you live by yourself?
I live with my mom.
Oh, with your mother, okay. So you kind of take care of each other?
Yeah.
How old is she?
76.
Really?
Yeah.
She pretty good health?
Yeah, just worn out parts.
Yeah?
Yeah, knee surgery, back surgery, stuff like that.
So she tells you what to do and you do it?
Pretty much.
Perfect. Religion-wise, you said you were Presbyterian and now you're non-denominational.
You're right.
How long has that been since you switched over?
Oh, when I was a kid.
Okay, is that something that's important to you at this point in your life?
My
Your
faith is important, yes.
Okay.
I don't believe in organized religion, but my faith is still important to me.
So do you attend church now?
No.
Very good. Would you like to, if we continue treatment after this, would you like to incorporate faith?
Sure.
Okay, good. Very good. In your own words, can you tell me the nature of your thoughts of dying? Is it only when you have the attack and just then only? Or
Then
is
and
it-
only, yeah, because at that moment I feel like I'm actually dying.
Okay.
Now I realize that I'm not when it happens.
Okay. I just wanted to clarify that because it can make a difference. So,
Sure.
how severe would you say your symptoms are? Are they very severe, extremely severe,
I would say moderate to severe.
moderate?
Yeah, but definitely moderate for
Okay.
sure.
So moderate to severe. So
Yeah, somewhere in there.
very good. Are you taking any medications at all?
No.
Nothing. Not for anything. I see that when you were young, you marked down that you had some bedwetting, thumb sucking, fears, and nail biting. Is none of that's present today?
Oh no,
Okay.
no, and that was all just typical childhood stuff, you know. If they were
So your fears were?
just traditional childhood fears, monsters, stuff like that.
Did you have any fears of being abandoned, or it was just monsters?
Just monsters, ghosts, stuff like that.
Okay. You had nail biting too. You don't do that currently?
No,
Do any sleepwalking?
no.
No. Okay. And your childhood was happy. Good. Says you had chickenpox, influenza, and measles. No hospitalization.
No. All right.
It said you had mono. It says doctor cleared that up. When was that?
That was when I was like 15, I believe.
Okay. Guessing the girls were you?
No, I was took a drink out of another kid's
Oh, you got it the non-fun way.
in the non-fun way. Yeah, right out of their pop.
Okay. Surgical operations, you had your wisdom teeth out, knee surgery, and quadruple bypass.
Yeah.
Well, that's interesting.
Yeah, I had a heart attack and then a quadruple bypass. I'm all good now.
Well, no wonder you have the fear of dying when you start experiencing symptoms.
Right.
Yeah, I don't blame you there. But it's good that your doctor lets you know that's not what's happening.
Yes. Yeah, he said I'm good right now. My
Yeah.
heart is working great.
Fantastic. You had a car accident and a head-on crash, it says?
Yeah.
Tell me a little about that.
It's a kind of funny story actually. I was driving to work and there was a moth flying in my face. So I rolled down the window, I went like this, and I flung it out the window. And when I was like that, the car in front of me switched lanes. And in front of that was a stalled car with no blinkers on. And so I never saw it coming and I hit it head on at 45.
No kidding.
Yeah, and I wasn't wearing a seatbelt, so I went right into the windshield.
Oh, you get a good injury out of it?
Yeah. Well, I blacked out for a second.
You hit your head?
I did. My head went into the windshield and I took out a chunk of my eyebrow.
And were you hospitalized for that?
I went to the hospital, emergency room. They cleaned out the glass out of my forehead and checked me out and said I was fine.
Did they do an MRI scan or anything?
No.
Make sure there's no damage. Do you have any swelling after that you're aware of?
No, not that I'm aware of.
Any recurring headaches from that?
No,
No vision problems, no hearing problems, just everything's...
just old age.
Okay, I understand that. When we went through this, I asked you to circle a few things. Yeah, it looks like you did a good job on that. It says you experienced palpitations,
Yep.
and I'm assuming if any of these symptoms aren't related to your attack, let me know.
Right.
Okay. So we have palpitations, unable to relax.
That's during the attacks.
Okay. Depressed feelings. Tell me a little bit about that.
Just mild depression that I've kind of
Since then or before?
Before.
Oh, before. Okay. And how long has that been going on for?
Several years.
Have you taken any medicine for that in the past?
No.
All right. Feel tense?
When I get worried a lot about having another attack. So.
Is that your primary worry, though?
Yeah, I worry about that all the time anymore.
Okay.
So.
I can understand.
And that actually does affect me being able to relax. So it's not just during
Sure.
episodes.
Because this can happen when you're sitting in a chair.
Right.
All of a sudden it just comes out of the blue, and bang, there you are.
That's exactly it. And
How long does it last?
It varies, but a lot of times it can go 10 to 20 minutes
Okay.
even.
And then it subsides all of a sudden, or is it slowly?
It's slowly.
Ramps down?
It starts up small, and then ramps up, hits its apex, and then comes back down gradually.
Do you feel tired a lot? Fatigue?
A lot of times because I don't sleep as well, because I'm worried about having another panic attack.
Okay. Other than that, if you weren't worried about that, you'd think you'd sleep pretty good?
I think so.
Okay. Anxiety, that's understandable. Is that mostly at night, or is it during the day too?
Mostly at night.
Why do you think it's more at night than during the day?
Because I don't think I feel it as much during the day, but well, sometimes I guess because it's affected my work.
Okay.
So
So you feel like you have the fear of it happening there. Has it happened at work?
it hasn't happened there, but I'm worried that it might,
Right.
and that would be highly embarrassing.
Do you drink at all?
No,
Okay. And as I see the tremors, are you shy with people?
no,
Oh. You had marked down you were shy with people.
oh, no.
Okay, we'll just scratch that off then, no big deal. How about any additional problems? You said enjoys mom company. I'm trying to read. Can you tell me what that says right there? I'll make sure we don't miss anything. So.
Well, I don't know what that is.
Alright, well, I'll skip over that for now. I asked you to circle some words that apply to you. The only one you circled out of all these was anxious.
Yeah.
But you did mention you have depression, or you feel
Well,
depressed.
that's true.
Okay.
I must have missed that.
Unconfident? Are you confident
Yeah.
yourself, but just not in public situations.
Right now, I'm just worried that I'm gonna have another panic attack, and I worry about it constantly.
Um, very good. Any additional words you would use to describe your feeling? As it
Just-
relates to your depression or worry, I should say.
Oh, no.
No? Okay. Present interests, I see you like karaoke.
Yeah.
Okay, and sports. Very good. What kind of sports you like?
All the major sports.
Yeah, watch them all, huh?
Yeah.
Karaoke gotta be a little rough when you think you're gonna have a panic attack. Probably don't want to go out and do that often.
Right?
See if we can get you back out there. We can start singing again. Are you a good singer?
I don't know. Not too bad.
You enjoy it, right?
It is fun. It is fun. Very fun.
How's most of your free time occupied?
You know, I'm so busy most of the time that when I come home, I just relax in front of the TV for a little bit and then go to bed.
What are you busy doing primarily?
School and work.
Oh, you're going to school.
Right.
Oh, okay. Does that cause stress for you, or?
Sometimes, but I've never had a panic attack after school. So.
You don't think your panic attacks are related to a school situation? You're doing
No.
pretty good in school?
Oh, yeah.
Okay. Good. And how often do you go there?
Just once a week.
Once a week? Like for a block of time?
Mm-hmm.
Okay. What's the last grade of school you've completed? So it says your first year of grad school?
Right.
This is your first year, okay. Any special ed classes when you were younger?
Any special ed? No.
Okay. Ever diagnosed with any learning disabilities, ADHD, ADD?
No.
Nothing like that, okay. Were you ever bullied?
Yes, once when I was a kid.
Not as a rule? Or
Not as a rule every day, but just
Does that bother you still, or?
no.
Good, good. How about making friends? You make them easily?
I do.
You do?
I do.
Okay. That's good. You keep them?
Generally.
Oh.
Sometimes they get away.
Sometimes you can't catch them.
Right.
That sounds like me with girls. What sort of work you doing now? It says you're a florist.
I am.
It's very interesting because I saw one of your previous jobs was a stockbroker. It's kind of a big switch. Tell
Well-
me about that.
Well, I switched mostly because honestly, that's a high stress job. And I was afraid that I'd have a panic attack there. And
Oh,
then
so
I'd
you were
lose-
having panic attack while you were a broker.
No, well, yes, but I wasn't, not at work. But I was
okay.
afraid I was gonna have
I
them.
see. And you said you were a fireman before that?
Before that, yeah,
And a dog walker.
and yes.
That would probably cause me
Okay.
stress trying to untangle all the dog's leashes.
It can be chaotic for sure.
So how do you like being a florist? Is it satisfying?
You know what? I don't have to think that hard, and it's peaceful, so I like that.
Just a big switch from stockbroker, so.
Right. Well, I like to get back to that.
You
know.
would eventually?
Yes, I'd like to get past whatever I'm going through here,
Okay.
and that's one of my goals
Does being a florist satisfy you at all?
for the time being.
Okay, so it's not a career you.
No.
It says you're earning about 18,000 a year. How did you do as a stockbroker? Was it significantly more?
No, yeah.
And is that something that's important to you, the money, or is it more happiness you were about?
Happiness is more important to me.
All right. Your parental attitude towards sex, did they talk about it a lot in the home? Were you educated in any instructions, or?
No, they only said one thing to us about it, and that was, don't get a girl pregnant.
You figured out the rest of what that meant on your own?
Yeah,
Very good.
pretty much in school.
How's your present sex life? Is it satisfactory at all?
No, I'm not in any relationships right now because of this. So
Because of this?
yeah, so once I can get past this, then I think I can.
When was your last relationship and how long was that?
Oh, it's been a couple of years now, actually. But
So prior to the...
prior to.
Okay. Do you think that could have had anything to do with stress levels, or?
No,
You're
'cause
pretty...
No, because this started only about 3 months ago, so. my third month.
You don't think that breakup was that your idea or hers, or kind of a mutual thing?
No, that was hers.
Okay. How did that affect
It was a shocker for sure.
you? Yeah.
But yeah.
Are you over it now, or
Oh yeah. Oh,
you
yeah.
don't have any hanging issues?
No.
And how long have you been over that?
It's been a couple of years at least.
2 years?
Mm-hmm.
Alright. Have you ever been sexually abused?
No.
Very good. Let's see. Tell me about your father and your relationship.
It was a rocky one, but in the end, well, I think I got a little bit of a relief from that. 'Cause he had a stroke.
Can you describe Rocky?
He was well, he was somebody with antisocial personality disorder. So,
Yeah, you mentioned that.
so he was pretty miserable as a human being, and he was severely unhappy. But at the end, he had a stroke, and then he was really nice to be around.
Yeah.
About the last year and a half,
Huh.
I got to see what it was like to have a real dad.
Do you have you processed that?
Yeah,
Yeah.
Yeah.
Okay.
yeah,
Okay. And it says you were 49 at the time, so it was recent.
yeah.
Okay. Heart failure was the cause?
Yep.
You already avoided that.
Yes, I
You're
did.
rebuilt. You're good for another 50 years.
Right.
Anyway, how about your mom? You say she's living.
Mm-hmm.
76, and you put Spunky.
Spunky is for sure.
Very good.
She'll outwork all of us.
And she's retired in decent health.
Yep.
We got 5 brothers,
Yeah,
and you're in the middle.
I am. Although I've been in every position. I've been the oldest, I've been in the middle, and I've been the baby.
Which one you like best?
Um,
Probably the baby.
they're all different.
Yeah?
Yeah, to be honest with you, they're all different.
Okay. You get along with them pretty good?
Yeah.
Yeah?
Yeah, I always have.
And they didn't lock you up in boxes or anything, or closets?
Well, one older brother did lock me up in the attic a few
You're
times.
probably able to pass that down to the littler brother then, right?
I never did that
No?
to him because I didn't like the way it made me feel.
You were the nice brother. Okay.
Yeah.
So you got a good relationship with them. Good. Relationship with your mom's good. And we talked about your dad already. So how were you punished as a child?
They did normal spanking, nothing excessive by any means.
Okay.
But when I got old enough that they shouldn't spank me, they would ground me.
So nothing severely abusive.
No.
Okay.
No.
Good. Give me an impression of your home atmosphere, compatibility between your parents. Do they fight a lot, or
They argued a lot. They
Did they?
did, yes.
How did that make you? How did you react to that?
It made me a little nervous, a little afraid,
Yeah.
because I wasn't sure what was going on.
Nothing physical, or was?
No,
Okay.
my dad never hit my mother.
Okay. Mom never hit your dad. Never.
No,
You never got in the middle of it. Nothing.
No.
Okay. Good.
no, they always did it away from us.
Okay. Says you have religious training. Oh, you went to Bible Training Center
I did.
in Oklahoma.
Yeah,
Okay. And you did 1 of 2 years. How come you didn't do the second?
I couldn't afford to go back.
Oh. Okay. So it was a money thing.
It was. Now it works out good since I don't subscribe to organized religion.
Okay.
So it was kind of a blessing in disguise. But it did help me with my faith. So
So your faith's very important.
it is.
All right. Does a member of your family suffer from alcoholism, epilepsy, anything, even cousins, or? I know I asked you
I have
earlier.
an
but-
older brother actually. He drinks a lot. I would say he's an alcoholic.
Okay. Mom and Dad didn't drink though, right?
No.
Speak up.
No.
have emotional issues such as crying, extreme anger?
Like uncontrollably, or just
Where you think where you would judge that to be a little over the top, maybe?
over the top. Never really with anger. I guess I would say that I've had strange episodes of crying, where for no reason, all of a sudden I'm choked up a little bit and tears start coming out my eyes.
Has nothing to do with thoughts.
Don't know anything why it happens. It's just out of the blue.
Is that something you'd like to explore a little bit too?
Probably, because it probably might be connected.
Well, we'll see.
Yeah.
Possible. I said list some situations that make you feel calm or relaxed. You said playing your Xbox.
Mm-hmm.
You
Yeah.
like video games?
Yeah.
Those cause me stress because I'm not very good.
No, it relaxes me because I used to game all the time. So now if I get stressed out, I just go play a couple games and.
You kind of get lost in video world.
Yeah.
Oh, nice.
To be honest with you, it really does calm me down because it shuts my mind off. I don't ruminate as much.
You feel like your mind races a lot?
When I get going, yes.
Okay.
And at nighttime sometimes.
So you have some problems going to sleep because of that? Your mind is racing?
Yes.
Is there anything in particular you think about a lot?
Anything and everything.
Really?
Yeah, it doesn't. There's
Would you
nothing
say
in
that?
particular.
Would you say that your thoughts at that time are more exploratory, or are they focused on issues maybe in life? What would you say?
I mean, I could sit there and just start thinking about what ifs, but not even about me. You know, concepts and.
Give me an example. Do you remember one recently?
What if we came up with a better battery? You know, I mean, how would we do that? And I started trying to think about what that would be like and what I could do and what experience could be. You know, it's what
Is that
happens.
more at night than during the day?
Well, that can happen all the time, but I mean, it prevents me from sleeping at night. During the day, it's a good thing
Does your so your mind doesn't really wander, it kind of fixes on something to try to figure out?
right.
flop
I
all
don't.
over
I
the
don't
place?
subject jump in my
Oh,
thoughts.
okay.
It's just I just get focused on something and then I go through. And when I'm done, then I might go to something else. But my brain just doesn't shut down sometimes.
Okay. What would you like to accomplish from therapy?
I'd like to start having these attacks.
Okay, so we're gonna explore panic attacks. Is that what it feels like, you're panicking a little bit when that happens?
Well, I can be completely and utterly relaxed. That's what's baffling about
But
it.
when it happens, it causes
But as soon as it happens,
extreme anxiety.
extreme anxiety comes on. Yes, it starts real small.
Did your doctor mention panic attacks at all, or did he didn't have any idea?
You know, when I went to the ER the very first time I had it, that's what they told me.
Okay.
They said, "There's nothing wrong with your heart. You're having a panic attack." And I said, "I'm not
Oh.
anxious about anything." And so then I went to my doctor and tried to rule it out, and he couldn't find anything wrong. You know, I mean, everything's doing fine. I'm very healthy, but I get these.
Well, I'm not going to say you're having panic attacks at this time because there's several things that can resemble that. So that's why I'm asking all these questions. I want to get a good picture of what's going on in your life so we can kind of rule some things out too.
Sure.
We'll get down to focus on it, and then we'll be able to, you know, if you'd like to, we can tailor a treatment plan that fits your need.
Yeah.
Because there's no sense treating you for something that you don't have, right?
Right.
So we'll take a little bit of time, and I will look into this and real deep, and I may have some more questions for you. But we want to explore that. How about your depression?
Yeah, we can go over that.
Scale of 1 to 10, how much would you say your depression affects you?
You know, 3 or 4.
3 or 4 daily.
Yeah.
And has that increased since your panic attack?
Since the panic attacks, actually, I would say it might even be a little higher now, actually, than 3 or 4.
Sure. Because you're worried about it and you're probably not doing the activities you used
Right,
to.
and it's depressing having to go through this all the time.
So a lot of your activities you enjoyed doing in the past, you're really not doing now because you're afraid that this is going to take place.
Right.
Okay.
Yeah.
Is anybody with you when you have them? Has anybody been with you?
No,
No?
no, I've always been alone when it happens, and
Has your mom seen them?
no. Try to keep them, but I mean, I can't control them. If I could control them, then I wouldn't be here.
Right, exactly. Well, I understand that. I'm going to say that I want you to remember you're not in physical danger at this point, okay? It's not a physical problem, so to speak. In many cases, when there's panic attacks involved, people do feel like they're dying. You feel like you're having a heart attack. You're short of breath. They start sweating. They have a lot of different. There's some people that actually turn blue and believe they can't breathe, but they are breathing.
Right.
And it can be pretty scary. But many times people can work through these things. So if that is what it is, we'll tackle it. We'll take a good run at getting you taken care of here. I'm leaning toward that, but again, I want to rule out some other things. I don't want to jump the gun and tell you you have something when you don't.
Right.
And that's why I asked you if your doctor maybe had mentioned that, or your dad, somebody had mentioned possible panic attack. So,
Mm-hmm.
because it sure is leaning that way. But again, we'll know more when we meet next time.
Yeah.
So today, all I wanted to do was have a chance to get to know you, meet you, see what you got going on, and get a good picture of what we're working with here.
Yeah, I like that.
Yeah, you seem like a pretty good guy. Let's get you back on your track in your life.
I'd like that. I'd like to get past this and move on and
Sure.
get my life back under control again.
I think you can do that.
Yeah, it's been difficult. Like I said, it's quite baffling because I don't feel stressed before it happens.
Not at all.
And nothing happens during the day, so I don't have, I guess, what you would call a trigger.
Trigger moments?
Yeah, it's not like I had a fight with somebody or had something bad happen at work or anything like that. It's just right out of the blue. I'm just enjoying a good TV show, and then all of a sudden I get cold, and then I feel the tension start, and it ramps up.
One thing I'm wondering about is you have this inability to relax. I'm looking back
Now.
over what you checked.
Not before though.
Not before.
Not before, but now it's tough for me to relax because.
And that's affecting your sleep. How long do you sleep at night?
About 4 hours, I would say.
4 hours.
Yeah, that's not enough.
No, you feel tired during the day.
I do. It's sluggish. Can't focus as much.
Do you find that your mind races a lot when you're tired? When you start thinking about things, or you just?
It can race at any time,
Doesn't
even
really
during
matter.
the day. Sometimes I gotta stay focused. Sometimes.
So if you were at work concentrating on a project, and you had a inclination to worry about reinventing the wheel, so to speak,
Oh, I would generally push it aside. Now, if I
you have the ability to push it aside.
Yes.
It's not just like it invades your thoughts and it sticks.
right at that point, I can push it aside because I'm
Okay.
focused on something.
Okay.
But at home, when I have nothing going on,
Okay.
my thoughts just start going, and then I can't always shut it down.
Do you feel unrelaxed when your thoughts start doing that, or can you be relaxed and still think through these things?
No, I feel a little anxiety. I'll be
Do you?
honest with you. Yeah.
In what
What
way?
happens? I just feel because I want to sleep more
Okay.
more than anything. I'm really tired when it happens, and I just want to go to bed, go to sleep, but I can't because I can't stop thinking.
So they're not worries;
No,
they're just thoughts.
they're just thoughts.
Do you have any worries at that point, or is it mostly just
Not
thinking
normally.
about abstract things.
Unless I'm worrying about having another one of these attacks now.
Right.
You know, because I'm worried about that most of the time. But a lot of the
Probably
times.
not worried about that as much at bedtime as you are in the day, huh?
No, well, the bedtime is it's in the evening when they happen.
You haven't had any during the day?
None during the day, ever.
Hmm. When you're winding down from the day is when they take place.
Already wound down, I would say.
Okay.
When I'm at my probably most relaxed outside of sleeping.
Do you get any tingling feelings in your legs or your hands?
My hands.
In your hands?
Mm-hmm.
You get restless leg at all, or
Not restless leg,
No?
no. But my hands will tingle sometimes.
only then, pretty much?
Pretty much.
Let me ask you just a couple other things, if you don't mind, and then I'll let you get out of here, because I know you have other places you need to get to today, you mentioned, so. Does it feel like your throat's choking up at
No.
all? No?
I have shortness of breath, but not my throat's not tightening out.
Okay, and you said you don't sweat, but
No.
you feel your heart pounding,
Yes.
and you mentioned lightheadedness
A little bit of lightheadedness. Mm-hmm.
and intense fear.
Yep, and chest pain, for sure.
Has your behavior changed at all? Now, I'm not talking about things that you do during the day. I'm talking about your behavior as in how you react to situations or how you view things. Has
No.
that changed over the past couple of years at all?
Not how I view things or anything like that. Just, no, I think my thoughts
So
are.
you don't feel you have changed, you just have this going on?
Whatever this is going on, and I just want it done. You know?
Okay. Well, I think I have just about everything I need here to look into this and see what we're dealing with. Would you like to go ahead and attack this and start
Yeah,
doing it?
I think so.
Okay.
I think so. I think with your help that I can.
Well, what we'll
Move
do,
on.
I don't like to tell anybody what to do. What I'd like to do is develop something with
Right.
you involved. So this is a plan of treatment that you can live with, and something where we're headed in the right direction. And if we do it together and we kind of form a team on it, I think we can get figured out pretty good.
Okay.
So we'll put something together that's not overly taxing, but aggressive enough to where you can feel comfortable attaining your goals.
Yeah.
Because, to me, it sounds like some kind of a panic disorder, and I'm going to have to look into it a little bit to be sure.
Okay.
I wouldn't worry about, don't worry about it too much for now. But what I want you to do is when you leave here, I want you to journal your thoughts when you have one, if you're thinking about something.
Mm-hmm.
Just, and it doesn't matter, it doesn't have to be the same thing or anything in particular, just whatever you've been thinking about recently before the panic attack.
Okay.
I want you to journal how tired you are and what your emotional state is at the time.
Right, so you want me to give after an episode, give you a before and
Yeah.
after?
Basically,
Feeling like I
before.
was feeling really good before, and now this is where I'm at after.
I'm more worried about before, but if you want to do before and after, that'd be wonderful. But make sure before, I want to know your emotional state, your thoughts, and what your reaction to those thoughts are. If it's something that's welling up emotions in your thoughts, or maybe you're just sitting there thinking about Christmas trees, whatever it might be.
Right.
Just jot that down, and then write the time on it for me and how tired you were.
Okay.
And if you can do that, I will see you next week sometime, whatever day is good for you. I have some openings, so you can check with my secretary on the way out, and she'll go ahead and put you on the schedule. And in the meantime, I'll get busy on this, and you do your homework, and next time we get together, we'll get it figured out. Sound good?
Sounds good to me.
Excellent. It was good to meet you, Jim.
Good to meet you. Thank you.
Look forward to working with you.